Okay, so sorry again for the technical issue and thanks a lot for the invitation. I'm always honored for such an invitation and also for the opportunity to talk about all the initiatives EuorbloodNet dedicated to sickle cell disease. They are a lot, so I'm sorry, I will be very quick, but likely we have some moments at the end if you would like to have more details, or you can contact me otherwise. So for those who doesn't have the concept, what's an ERN? An ERN is an initiative of the European Commission launched in 2017 for gathering all the knowledge, resources, services available for rare disease in Europe. So there is one ERN per branch of the medicine where rare disease exists. EuorbloodNet is the one dedicated to rare hematological disease. Now we cover 15 member states with official member and 7 more with associated partner Air Coordination Hub, but we are going to extend our coverage of expertise. So as said, we cover all the hematology. So we cover all the disease linked to non-oncological hematology and to oncological hematology. One is coordinated by Pierre Fernot, the other by the Professor Gulbis. But I will now focalize on rare anemias and also sickle cell disease. So what we can see in Europe is that there's a scattered knowledge and expertise for rare anemias and also for sickle cell disease. That's because we have a lack of patients cohort. We have scarce and fragmented data. That means that patients are under diagnosis or misdiagnosis, or that the diagnosis could be delayed. There's a lack of practical guidelines and treatment. We can think about the fact that bone marrow transplant is the only curative treatment, and a lack of basic and clinical research. So the approach of EuorbloodNet is trying to fulfill all these gaps. So that's why the initiative is very huge. How? We do that following 5 pathways, which are best practices, clinical trial and research, telemedicine, continuing medical education, cross-border health. So for what concerns cross-border health, what we are doing? Well, first of all, we are mapping all the expertise of sickle cell disease in Europe among our membership. You can find those information on our website. As you can see from my diapo, you can go on membership and then search experts, and then you will have the list. In the case there you need an expertise in some countries which is not mapping there on the website, you can contact us and we will find the information for you if the information exists. Then for cross-border health, we have conducted an analysis from availability of bone marrow transplant in Europe. And together with the analysis, we have launched a pilot. Well, indeed, Corina McCown is included in this action, so I'm glad that she talks just before me. So it's like creating a bilateral agreement of bone marrow transplant among 2 countries. So that means that we create a bridge of clinical service among these 2 countries, and Ireland could make their patients get a bone marrow transplant in Italy. This is ongoing because of the pandemic. The procedure has been blocked, so we hope next time to present a very good result. And also we are now conducting with the Dr. Raffaella Colombati that will speak after a survey on availability on transcranial Doppler. So it's to mapping the availability of these services, the access of children to these services, and their adherence to the sickle cell disease protocol of standard of care. The access also to prevention programs, and this will help us in identifying barrier and possible intervention to be offered. From our preliminary information, well, of course, we had the analysis, the sketch of analysis of accessibility to these exams in Europe. We saw different gaps in availability in terms of equipment and trained staff. Lack also of adequate networking among center and needs of the staff to be trained also when it comes to hematologists. If I go to the best practices axis, so we have gathered a repository of guidelines, recommendations, dividing, splitting it between disease, scope and purpose, if the patient was involved in the procedure of the writing of the guidelines, the rigor of the development. And for sickle cell disease, we have three specifically focusing sickle cell disease. And you can find them also these on our website. When you click on best practices, there is the repository of guidelines and recommendations. Also, we have endorsed recommendation on newborn screening for sickle cell disease in Europe, recommendations from a pan-European consensus conference. We also have had a webinar on it, which is available on our website, but I will show it later. For clinical trial and research, as you may know, we are establishing a registry on rare hematological disease, which is called Enroll, and one other that is gathering, the first one that is called RADIP. So it's the Rare Anemia Disorder European Epidemiological Platform. It includes, of course, also sickle cell disease. So it's an umbrella of already existing registry in Europe, and new one that will be established, and it will help in avoiding fragmentations. And also another platform for red blood cell disorder and COVID-19 patients. For what concern continuing medical education, so as Laura also said before, we are establishing a network of patients organizations of sickle cell disease in Europe, asking them to being organized first at national level and then at European level, with the scope of having an European patient representative that will collaborate with the ERN as an EPAG. So well, the concept has been presented before also. This is our results. For education also, we prepared on-site and online training for patients and also for health professionals. This is our experience at ASCA 3 years, so 2019, 2020, and now will be held in 2021. So we create a forum of patients and training them during the ASCA conference. Last year experience is present on our YouTube if you want to have a look. Those are the preceptorship that will be held for health professional, blocked by pandemic, but we hope that we retake them. So the idea is to have those training for health professional on sickle cell disease in sickle cell disease expert center of EuorbloodNet in order to spread the knowledge at a high level among hematologists. For webinars, as said, we have webinars for patients and health professional on our YouTube channel and on website on education, you can find them. I would like to recall the one already named, so the newborn screening for sickle cell disease in Europe held by Raffaella Colombati, and the one for patients on COVID-19. And we have an upcoming one, the 7th of October, with Marianne de Montalbert, speaking about sickle cell disease new treatment revision. So if you want to assist, just register on the website. And that's all. Sorry for being so fast, and thank you for listening.